Can a person heal? And how? Absolutely, a person can heal. How does a person heal from trauma? Well, medication can sometimes be helpful, but is rarely curative. The curative piece is processing the information. This does not mean that you have to talk about it. With children, making them talk about things in particular can actually lead to further traumatization. And with many adult clients, they also do not want to talk about things that are traumatic. Often, nonverbal therapies can be more useful than talk therapies. With children, we tend to use one of the many types of play therapy. And just as there are many types of talk therapy, there are many types of play therapy. They tend to fall into the more directive approaches or more indirect approaches. For assessment purposes, initially it's useful to use more non-directive play therapy. The child will let you know through play what it is that's salient for the child. However, the play therapist needs to have specific training in how to understand the child's play, because children communicate through play. It's amazing what a child can tell you through play if you learn to read the play of a child. There is a particular type of play that shows a child has been traumatized, and that type of play is called post-traumatic play. It's difficult for people to recognize, and it's even difficult for many therapists to recognize, initially, unless they're specifically trained in this area. Once a therapist is trained to recognize it and recognizes it once, then it's easier to recognize. If post-traumatic play is left unchecked, it can reinforce trauma. So it's extremely important to intervene in this kind of play, which means that one first has to recognize that this play is occurring and then can intervene. I think it's critically important that we nip these behaviors in the bud before they become problematic. I have worked with adults who did not receive therapy as children and, where they have continued to act out sexually. No child wants to grow up to become a sex offender. And most of these children, even without treatment, won't. It's prudent for parents and caregivers to educate themselves, to find therapists that they feel confident with, and to ask many, many questions, and to expect their questions to be answered. Thank you very much, and have a good day.